Chapter 8, Heart and Blood Vessels, Screencast 4. Now, this screencast is focusing primarily on how we control the cardiovascular system. So a couple of things that we need to keep in mind here. Okay? Now, homeostasis is important. So one of the big jobs here is making sure that pressure is adequate to do its job. So the regulation of blood pressure is especially critical. Now, how the body maintains a constant arterial pressure is generally because of two things. One, how do we regulate cardiac output? And cardiac output is defined as flow. So movement of fluid through the cardiovascular system. It's expressed in liters per minute. And average cardiac output at rest is about 5 liters per minute. And that's about total blood volume moving through the entire body every minute. This is also primarily going to be achieved by regulating the diameter of arterioles. Arterioles quite often are referred to as resistance vessels. And remember, when you vasoconstrict, that's going to result in an increase in pressure. Vasodilation causes a drop in pressure. Now, also, the other thing to keep in mind here is there is a difference in local demand. So local blood flow is going to be regulated based on need. Think of exercise as a perfect example. As you're exercising, a particular area of the body has greater need for blood flow. The cardiovascular system is going to adjust to make sure that those areas are going to get the blood that's necessary to meet the demand of the activity. But this will come at the expense of other areas of the body, such as the digestive system, the renal system, and so on. Because remember, we only have about 5 liters. So the body has the ability to direct blood flow to various areas as necessary. And usually the dominant factor is going to be demand. Now, as noted, blood pressure is one of the most important regulated variables in the body, and it occurs through a negative feedback mechanism. Now, one thing that I want to point out here, right now, we're looking at just a neural mechanism or a short-term response to blood pressure. What we're going to notice probably a little bit later when we talk about blood pressure overall, the body considers a drop in pressure to be more dangerous than an increase in pressure on a short-term basis. So there are actually more mechanisms that come into play when pressure drops. So I want to keep that in mind. So I would probably address some of these factors differently than how they are done in the textbook. The examples they use are primarily related to an increase in pressure, whereas I would probably put the emphasis on a drop in pressure. Now, as noted, these are negative feedback mechanisms. So if pressure is high, the body's going to do things to decrease it. If pressure is low, the body's going to do things to bring pressure back up again. Now, there are receptors known as baroreceptors, and they're found in 2 places. Within the aorta, so that great vessel leaving the left ventricle, and the carotid arteries. And those are the arteries that are responsible for blood flow to the brain. Now, a little bit of a side here, okay? So let's kind of think about this, all right? So if I press really hard on my carotid artery to take my pulse, there's a problem there, okay? These mechanisms do not know if the cause in pressure is due to some unexplained cause in an increase in blood pressure, or is someone just being stupid and pressing too hard on their carotid artery. In this particular situation, the baroreceptor reflex will kick in, and the body's response will be to decrease pressure. And it will achieve that through vasodilation, decreased heart rate, and so on. Okay, and all of those factors, okay, and this can be very dangerous because if someone is standing or exercising and they do this, they might actually faint. So it's really important not to press too hard on that artery in your neck, the carotid artery, when you're taking your pulse. So let's kind of walk through this mechanism. So let's kind of look at the steps first. Now, keep in mind what they're doing here is looking at an increase in pressure. So that's the first. So blood pressure rises. It causes the vessels to stretch. Now, the baroreceptors will fire at a greater rate. This is going to go to the cardiovascular center within the brain. Now, the cardiovascular center is going to send signals to the heart to lower heart rate and actually decrease force of contraction. This decreases cardiac output, which will lower blood pressure. Blood vessels will actually reduce vascular resistance, so they'll vasodilate, and this will increase blood flow to tissues. And the combined effect here is to lower blood pressure. Now, if pressure is too low, this is going to be reversed. Okay, so let's kind of take a look at the diagram. So overall, okay, blood pressure increases. There's an increased firing rate to the cardiovascular control center within the brain. And what this is going to do is basically result in increasing resistance, okay? So vasoconstriction, heart rate's going to decrease, contractility is going to decrease, overall cardiac output decreases, and this will cause a return to normal blood pressure. And as noted, it would be the exact opposite if pressure were decreasing. So in that situation, we would actually increase resistance and increase cardiac output to bring pressure back up again. So be able to respond or explain either the baroreceptor reflex for when blood pressure goes down or when blood pressure goes up. Now, keep in mind, local requirements are going to be important. So precapillary sphincters, they allow the fine-tuning of blood flow at a local level. So tissues that are active, okay, so metabolically active, such as skeletal muscle during exercise, they require more oxygen. So in this particular situation, these precapillary sphincters are open. That results in vasodilation and increased blood flow to that particular area. Now, if blood pressure drops precipitously, then blood pressure control would cause vasoconstriction to many organs and shunt blood to the brain and heart, where blood supply and pressure must be maintained. So the ability to direct, okay, where blood flow is necessary based on need is a very important concept. Here we're basically looking at what's happening. So this is at rest, so there's very little vasodilating substances being produced, and we would have a normal flow. Now, here we look at an increased metabolic activity. We have more of those substances that cause vasodilation. So what this is going to do, result in an increase in flow to that particular area. So once again, keep that in mind. Now, exercise is another example of where we see a very significant change in blood flow and cardiac output, because once again, the need is greater. Now, non-athletes, okay, now remember, normal cardiac output in a healthy individual is about 5 liters per minute. A non-athlete can actually increase cardiac output up to 20 to 25 liters per minute, whereas trained aerobic athletes, so distance runners, cyclists, and so on, they can actually increase cardiac output up to 35 liters per minute. So significant ability to increase cardiac output, once again, to meet the demand of exercise.